Welcome to Season 4 of Purposeful Empathy, a show dedicated to conversations with people from around the globe who understand the world needs more empathy and are doing something about it. Today's episode is brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching. Enjoy the show. Welcome to a new episode of Purposeful Empathy. Today I'm joined by Dr. Helen Riess, who is a psychiatrist and associate professor of psychiatry at the Harvard Medical School. In 2012, she founded Empathetics.com, a company that provides evidence-based empathy and communication skills training for healthcare, business, law enforcement, and education. Her new book, The Empathy Effect, has been licensed in 10 foreign countries, and I loved it. It was a great book. I recommend it to everyone. We'll have information in the description below. And her TED Talk, The Power of Empathy, has been viewed more than 600,000 times. And I have to say, I love the title. My TED Talk is the same title, but I haven't been seen 600,000 times. So kudos to you. Welcome, Helen, to the show.
Thank you, Anita. It's wonderful to be here.
Well, I love meeting people who are, fellow empathy enthusiasts, and you've done a big deep dive into empathy over the last decade plus. I'm wondering if there's any story that might explain what drew you to empathy in the first place.
Well, there's a sort of proximal story and a distal story, and the story that's closest to me was really listening to my patients in my psychiatry office spend so much time talking about how disappointed they were in their healthcare visits, how they didn't feel listened to. They felt like a number. They felt like they were just a person on an assembly line. And seeing the direct impact of people giving up on trying to lose weight or stop smoking and sort of throwing in the towel and feeling that we had to do something about this because, we take an oath as physicians to first do no harm. And I was realizing that this was very harmful, but this kind of treatment had seeped into healthcare insidiously. And the shortcuts people were taking were having a really profound effect. And at the same time, headlines in major newspapers were calling for more compassionate care. And that's what led me to do a fellowship in the neuroscience of empathy, where I really wanted to learn, can we put this back in and can it be augmented? And the distal story is that my parents both suffered from really terrible circumstances in World War II in Europe. And they came to the United States as immigrants. And I think just knowing their story and knowing how they suffered and also how they overcame has been sort of deep in my DNA. And really just wanting to do something when people are mistreated has just been part of me since I was little.
Yeah, so you know that they've overcome a lot and you want to be of service. I can really appreciate that. So while you were at Massachusetts General Hospital, you did this research on empathy, and what were some of the main takeaways about it? What did you learn?
So, the first big project we did was to try to answer that age-old question, can empathy be taught? Because 10 years ago, if you asked an audience of 100 people, how many people think empathy can be taught, you'd get 3 hands raised. It really was considered something that's sort of baked into your persona and your personality. And I was observing really caring people acting in ways that were really not demonstrating who they were. So I was clear that you could downregulate empathy. And so I reasoned that if this can get turned down, we must be able to, churn it up. But really, there was no evidence that we could do that. And so that's why I wanted to study the brain and understand, what actually happens inside of us that we can appreciate what other people are feeling and thinking and what helps us respond appropriately. So that led to large randomized controlled trial of empathy training based on neuroscience. And we did show that you could significantly improve patients' perceptions of their physician's empathy. It wasn't physician self-report, like now I think I'm more empathetic because I got this training. It really did translate to how patients rated their doctors. And there are three other big takeaways from my research group. A second one was that our training endures. So we went back and asked patients 1 year later, what do you think about your physician's empathy? And those scores maintained at the same level as when they completed the training. We also were asked, this must help healthcare outcomes, right? And we always wanted to nod our heads and say yes, but we really didn't have any evidence that, would support that. So we did what's called a systematic review and a meta-analysis of all the randomized controlled trials that showed that purely by changing physician comportment, so to be more empathic, more compassionate, to really spend time setting goals, motivational interviewing, like these things were the only variables in things like, trying to address obesity, lung infections, arthritis. And when they just manipulated how the physician behaved with the patient, there were 13 beautifully done studies that showed that these people improved just through the communication and empathy. And that was published in PLOS One. And we also did a study where we wanted to measure when you train or when you show empathetic care, do you improve ratings of warmth? But what happens to competence? Do people still think you're just as competent when you're nicer? Because there was some research done at Princeton that showed that professors were rated lower the nicer they were. And we certainly did not want that happening in healthcare. So we did another randomized trial and showed that the ratings by patients of physicians who demonstrated nonverbal aspects of empathy actually improved in warmth and competence.
Oh, that's great.
And that was a really important study, also published in PLOS One. So, and we did a study on cultural aspects of empathy to really discern what is culturally sort of universal in expressions of empathy and which things are more culture-based. So these are just areas that have been so interesting to explore.
I'm curious to know, typically in the healthcare service provision, it's gendered a little bit, right? More nurses tend to be female and more doctors, I don't know, well, historically anyways, have been male, and now maybe there's more gender parity. But there's a sense that nurses are more caring caregivers than doctors. Is that true? Like, is there any research that's debunking that or anything changing on that front? Anything you could say about that at all?
I would say that in general, that is true. Part of the job of nurses is to spend much more time at the bedside and to be attentive to patients, to give them their meds on time and to, answer the call bell and to be caring. It's an expectation. And, on the other hand, physicians get a few maybe one communication skills course in medical school. And, that's one of the things Empathetics is doing, that we are actually supplementing some of the traditional medical training, especially before they leave medical school, because these courses are often given in the first year. And the emphasis is much more on the cognitive, diagnosis and treatment, and much less emphasis on how you actually, relate to patients. But I think this is the tide is starting to turn because hospitals are being held accountable now for what patients say about their care.
I ask only because, and this is like my anecdote, and I have never shared this publicly, but I'm very lucky that I have had good health, knock on wood. I've never had surgery. well, up until this story that I'm about to share, never had any accidents. But when I was pregnant carrying my daughter, I was going through the process of having like natural childbirth with a midwife, which is available in Quebec as an option. And the dream was to like birth my daughter in water. And, I was watching all of these videos online. So I was doing like meditations and I don't even remember all of the different things that I was busy like preparing myself for this birth in my mind. And it ended up being like an extraordinarily long birth, 24 hours of, what is it called? Like not false labor, but like early labor pains. And then another practical day of like actually being in full blown labor where I had my water broken and, pumping and everything to kind of like initiate it. And I wasn't getting ready. My body wasn't preparing for this. So I was brought to the hospital. And I thought, the last thing I want to do is do this like without the natural childbirth that I'd been planning. But I ended up having such a kind doctor that talked about how my daughter was in the position where her chin was facing upward and wasn't in the right position. And she was a stargazer, right? That's what he called her, a stargazer. And he just gave me so much confidence that it was the right thing to go ahead with a C-section after all. Which was really was not part of the birthing plan. And so that was an experience with a really compassionate and kind doctor. And then post-birth, my daughter was born safely and she's healthy and everything was wonderful. I was resting at one point and woke up needing to go to the bathroom, but post C-section, I had no energy. I wasn't able to get out of the bed by myself. And so I kept pressing the button for the nurse to come help me. And this might've been in the middle of the night. And I was initially trying to be patient, trying to like empathize with what like a nurse might go through in her rounds. But like 10 minutes later, a second time, and 10 minutes later, like I really had to go until finally, like I couldn't get up and I couldn't hold it any longer. And it was devastating for me. And then when the nurse finally did come, she was upset because that required like a lot of extra work on her part. And I remember thinking, wow, like that just debunked my myths about the medical profession, which, are not fair, but I think that's behind the question. But I think in all the professions that you can think of, the medical profession is the place where you want the most amount of empathy and compassion, given how much vulnerability the patient is feeling, regardless of the circumstances, right?
It's a very powerless feeling. And you're exactly right that people want a caretaker more than a doctor and a nurse. They want someone to take care of them as a person, not just administer the right medicine or the right, procedure, but you want to be administered care. And I think that, your example of trying to do the right thing as a patient, like I'm trying to be patient. I don't want to bother you. I realize this. And then to be scolded, it is devastating. And this is part of, I think, what really galvanized me as a psychiatrist, just hearing really raw stories of how people were treated that were so at odds with what I think draws people to healthcare professions. People come to healthcare because they want to help. So, there's so many things wrong in our healthcare system that lead to the level of burnout and exhaustion that we're reading about all the time. And I hope that one of the silver linings of this pandemic is that, the shield has been lifted about just how hard these people work and how much support they need. And also, when a patient has a bad experience, that be taken seriously, almost like a physical injury. It's an emotional injury.
Yeah, it really speaks to, I was going to ask you about the pandemic, what insights, but I think you are so right to say that we take the healthcare system a little bit for granted, it's so essential to a well-functioning society. It is so essential. And, I think if you've discovered training that actually elevates professionals' capacity to express empathy and for that to be felt. I mean, that's just so important. Are you starting to notice that there's demand for your work in other spaces outside of healthcare?
Yes, it's so interesting that you ask that, because right now, as we're coming out of the pandemic, there's a lot of interest from healthcare again. But when everybody was facing with the devastation of not knowing what they were doing, not having protective equipment, empathy training kind of went on the back burner a year ago. But we started to hear from law enforcement in the summer after George Floyd was killed. Some police department reached out. We did our first training, and now 11 other departments have contacted us because through my book, a police chief realized that I'm not only talking about empathy for healthcare, but empathy for any group that needs to, be public facing. And, police are supposed to be guardians of our communities, not just warriors. And he was concerned that we maintain and build on the guardianship aspect of policing.
That's very heartening to hear.
It was really, I mean, over a decade that I've been doing this empathy training work, it was one of the most truly gratifying and inspiring, trainings I've ever done. Because the police were, they were initially, you might imagine, a little reluctant and like, what are we doing here? And the way we, empathized with their vulnerability, which they truly needed, because not all police are doing what we're seeing on these videos that are going around. And the shared sense of, being a victim of prejudice and bias, which heretofore has mostly been seen coming from them, but they were experiencing it, was a beautiful joining of what it's like to be part of a group that is prejudged, that is, not given a benefit of a doubt. And it was very powerful.
So whether it was from the training with police officers or from healthcare providers, what are some of the things that you're hearing post training that surprises you, or that really that moves you as somebody delivering the training?
There's so many things, but one of the comments we hear over and over again is, I can apply this training to every aspect of my life. I'm using these skills with my teenager, or I use this with my 3-year-old. I learned how to listen with compassion to my husband. And instead of like escalating, we just started to hear each other. And I mean, it is so rewarding that people take this training that's offered in the workplace and apply it, to their personal lives and their friends. And, that's why, there's a saying, one drop can, make the bucket overflow. Like if you've got a lot in there, but it's not coming out, like maybe a few insights can actually tap into something that's going to, make this flow more easily from people.
So that begs the question. I mean, you studied empathy and you apply empathy in your training. You're encouraging others to apply empathy. How have you noticed yourself as a person evolve in your behavior or in your relationships? If you'll indulge this question, pre and post research, I'm curious.
Well, we all are learning what we teach. And sometimes I'm even surprised by the things that I'm, like the insights I'm sharing, because it's almost like I'm talking to myself. I mean, you must see this in your work too, that some things come out of you that, I don't know, they were forming inside, but suddenly they're articulated. And I think this capacity to listen openly without judgment. I don't consider myself a judgmental person, but we all think we know what the person's going to say, or think if we can add that to this, fill in the sentence. But what I have learned is that, the less I say, the more I'm learning, and the more I can offer just by the gift of listening. And so that's been a really huge takeaway for me.
Yeah, listening. That's a sticking point for me. I'm involved in listening circles, and I realize, what a terrible listener I've been most of my life. I think listening is an underutilized verb in our culture. So yes, thank you for that. Thank you for sharing that. You and your teams are dedicated to transforming organizational systems into compassionate care systems. So what do you mean by that, compassionate care systems?
Well, through the work with hospitals and hospital systems that we're doing now, we really do see that the strength of an organization is really measured by the compassion of its members. And, you can have places that are renowned for their research, or, being the first to do this kind of operation or this procedure. At the end of the day, what patients say about a healthcare organization, or what people say about a company they work for, it's all about how they're treated. And so our mission really is to work with the leaders of organizations and to help them get it. Because, there are all these layers in a hospital, there's a CEO, CMO, chief medical officer, chief nurse, now there's a chief patient experience officer. So there's actually someone in charge of how the patients are experiencing the place. And we invite all these people into our workshops. And when you get a chief medical officer, a chief nurse, and usually the chief experience officer is there anyway, but if you get a leader of an organization to actually hear the role plays, to hear what people are talking about, their empathy challenges, sometimes there's a policy in the hospital that's actually making patients really upset, like a test that everybody has to take. But then patients are like, I don't want to take that test. And they get into a fight with the nurse, so all kinds of things come out about the whole organization when the leaders are involved. And that's when you get a transformation about what are we going to emphasize here, or how are we going to open the channels so that when patients are upset about a policy, we actually hear about it upstairs, instead of having, these conflicts played out, with people who are powerless to change the policy. So that's how we try to transform organizations, by working, throughout the entire hierarchy.
Now, some leaders get it, and some leaders can get it by being exposed to training like yours. But what would you say to the skeptics that are still of the opinion that empathy as a leadership skill is like just, soft and fluffy, and that it actually doesn't translate into meaningful cultural shifts that have bottom line implications?
Well, it's funny you ask that, because last week we had 2 calls with some hospital systems where the person calling said exactly what you just said. The person who's going to need to sign off on this is a skeptic. So how do we convince them? And this is after I gave a presentation, with our research and testimonials and all this stuff. I said, I'd like to give the presentation again, but this time invite that person. And so instead of the subordinates going to the leader saying, can we please do this? It's like, bring them in, or bring her into the conversation. And when they see that this is scientifically based, there's academic rigor, there's also brain changes that happen, that we can show all of a sudden you go from somebody who's thinking like, oh, this soft stuff, like, you know, like we don't have to, all of a sudden you get their attention. And in both cases, the skeptics ended up saying, we need to do this. So we have to invite everyone to the party. Now, will they come every time? No. But, you know, I think that when we have, you know, data, science, and heart involved, people start to listen.
Yeah. Now, if we were to move away from professions, right? So, you know, you're a psychiatrist, you were drawn to the patient experience. You also had your own family story that kind of called you into this orientation towards like elevating empathy in the world. You know, you could probably work in the medical profession for the rest of your life and never run out of clients. And then, you know, if we add law enforcement in there and then teaching in there and other organizations, I mean, you've got your work cut out for you. But just out of curiosity, from like, you know, 64,000 feet up, when we look at the world and society writ large, right? What do you think we could do to foster more empathy and compassion in the world? Like, what role does it play sort of like at the aggregate level?
Well,
no small question, you know.
A big question, but it is the question of the moment. You know, I think the Band-Aid's been ripped off about what's going on, not just in our country but worldwide, about health disparities, about racism, about structural inequities. I mean, it is really hard to walk around today and be blind to these things. And I know there are forces that are trying to put blinders back on, but it's really hard, you know, to unbreak the glass, you know. So I think we're at a moment in history where everybody who has anything in them that says, we need to change this, I want to be part of this change, this is your time to step up. You know, whether it's joining a community organization or pitching in at a food bank or like anything. Because really, when we think about what is our purpose and meaning here, you know, I think just accumulating more stuff for ourselves it's so empty. But feeling like you're making societal differences in making life better for people who really have never had a chance, had a chance at what we call the American dream, which sometimes feels like the American fantasy for some people. But to really step up in this moment, because we've seen in the last few years what unempathic leadership looks like. And I think people really got very nervous about it.
I totally agree. And I think about, as we're taping this, it's the end of April, and I'm reading about what's going on in India right now, right? So, the Western developed world is kind of seeing the light at the end of the tunnel, COVID-wise, because the vaccinations are hitting more arms. Even then, there's still a bit of a struggle, but there are so many places where, and it's not just about COVID either, right? Like you said, there are just so many systemic issues of inequity and injustice that we could all step up to flex our empathy muscles.
Absolutely.
Do you have a story or any memory or occasion that comes to mind when you were on the receiving end of empathy, or what I call purposeful empathy, and how that impacted you?
I do. And it's my own healthcare story. A couple of years ago, my father had a slow kind of deteriorating illness. And we knew at some point, he was not going to get better. But it was so gradual that when I got a call, on a Thursday for my sister who lives on the West Coast. I live in Boston and she lives in Portland, Oregon. She said, Dad's in the hospital, and if you want to see him, they said you need to get here in the next 24 hours. And it was just such a shock because he'd been sort of gradually declining. So I got this call right before I was starting a talk, and I figured out that there was a plane after the talk. I gave the talk. I don't even know how I gave the talk, but I was already up there, so I did it. And so I got the last seat on a plane to Portland, and I got there at like midnight. And my sister said, we need to go straight to the hospital. I'm not sure he's going to make it, until the morning. So we drove there, and my dad was in very labored breathing, and but he was alive. And I believe people can hear things even if they look like they can't. And I sat next to him. I held his hand, and I said everything that I wanted to say to him. And his breathing, he was in very labored breathing, but his breathing started to really slow, and it became peaceful. And then it stopped. And then the nurse came in, Teresa. I hope she's listening to your program, because I never got to thank her. But she came in the room because I guess the monitor showed that his heart had stopped. And she said, "Did he just pass?" And I said, I think so. Like, there was no pulse. And she looked at me with this beautiful look, and she said, "He was waiting for you." And I just burst into tears, because the whole way it happened, I mean, I really was with him for under 20 minutes. And I got to say what I wanted, and I think it helped open the gate for his spirit to leave his body. And I just thought, of all the things she could have said, "Oh, well, it was his time," or, she could have made it all about his death, but instead she made it about our relationship. And that meant the world to me. And I sent her a copy of my book. I only knew her first name, even though I called and she was actually just rotating through there. So I couldn't find her, but maybe she'll hear this story through your podcast. I hope so.
Thank you so much for sharing that story. I'm sorry that your dad passed, but we love all the Teresas of the world, and we can be those Teresas too for others. Showing empathy is available to all of us, and we can look for ways to be more empathic. So I like asking that question, because it always brings such beautiful stories to the end of the conversation. So thank you, Helen. I really appreciate that
question, and thank you for letting me share it.
So thanks for watching, everyone, and for listening. We'll see you next week at Purposeful Empathy. Bye-bye. Thanks, Helen.
Bye.
Now, what if you had access to your own council of coaches to help you break free from your own thinking clutter, make that important decision, and liberate you from whatever is holding you back? At Grand Huron International, you get to select a coach of your choice anytime from anywhere. Visit grandhuroninternational.com and harness the power of on-demand coaching today.